It's Andy Austin here. I'm just back from Holland, having taught a Metaphors of Movement workshop. Now they've sent me back with a list of questions to be asked about integral eye movement therapy. So I'll go through them one by one and see what happens. Okay, first question. Is there more information about what is going on in the brain that causes negative emotions to disappear? The answer to that question is probably there is. I'm very keen to avoid coming up with a very detailed neurological explanation as to why moving your eyes in the ways that we do with IEMT is so effective. The reason being is that neurological research is so quick now. Everything changes. Each week there's a new publication that basically changes everything that came before. So I'm keen to avoid trying to come up with an explanation. It appears, and I can only say this, it appears that it's something to do with the limbic system. It might not be, of course. It might just be nothing happens at all. Who knows? Maybe it's a placebo. I don't think it is, though, I've got to tell you. It appears that it's the hippocampus, because this is more focused around the memory of emotion than emotion itself, which would imply the amygdala. Because as we know with IEMT, when we start changing the memories of emotion, as opposed to just merely memories themselves, but memories of emotion, we start to change how we feel in the present. This appears to be a hippocampus thing. However, until we get somebody in a functional MRI scanner, and MRI people, if you have a free scanner that you'd like to give me to use, I'll be delighted. Until we actually put someone in one of those machines, it's going to be very hard to actually know one way or another. There is something worth knowing. With EMDR, which is the nearest analog thing to IEMT, the actual application and structures are different, but both techniques are using eye movements to create a change in something. There was a paper online which I saw which was, are the eye movements actually necessary? And so basically they kept everything else exactly the same, but they didn't do the eye movements. I mean, could you substitute the eye movements for something else? There's lots of people suggesting that actually this could be the case. It's a good point. I like the way that people are thinking with regards to this, but I'm still of the opinion that the eye movements do something very, very specific that is different to, say, tapping if you're going from each side of the body. I think there's something very different going on here. And it appears, again, I might be completely wrong, so I'm prepared to be disproven. It's the trochlear nerve. This is my hypothesis. You've got different nerves in the eye, and there's 6 muscles around the eye. Each one has its own nerve, and they enable you to move your eyes in all the directions. Trochlear nerve enables you to lift your eye up. If you paralyze that with a virus or, say, Botox, the eyes drop. That's why it's called the pathetic nerve, because people look a bit pathetic when they're always looking down. So it causes this change in stuff. It appears, if you look at the wiring of stuff, wiring of the brain, did I just say that? But if you look at the wiring, I suspect there is something happening with the trochlear nerve. That is as much as I can tell you, because that's probably the limit of my knowledge. If there's any neurologists watching this, or medical people who know far more about the brain than I do, which is probably a lot of people, do please put your comments below, because I will be interested to know that. Right, next question. How are we sure that this is happening within the brain? That's basically when we're doing changes, so we're eye wriggling, we're doing the chronicity stuff. How do we know actually anything is happening in the brain? We don't. Other than if we take the point of view that all manifest behavior is coming out of the brain and the nervous system. Now, whether anything physical is changing, whether there's the rewiring, remapping, all that kind of stuff in the brain, who knows? I don't. Again, my suspicion is, I think it probably is. Until we have the evidence, though, I'm reluctant to say for sure. But again, I'd be delighted to hear from people if you know anything different. You are explaining about the limbic system and the training and several parts. What is the purpose of this area in relation to IEMT? Now, one of the stories that I use in the IEMT to explain the differences is that memory is coded in so many different ways. Most people who are familiar with things like NLP or hypnotherapy, contemporary therapies that are designed to change the way that we think, will be familiar with the visual component, the auditory component, and the kinesthetic component of different experience. Now, memory, whilst it has all elements of experience, there are biases towards certain things. So, for example, there can be things that we remember where we are very attuned to all the visual data, but none of the kinesthetics. I can think of an accident I had a number of years ago. It's vivid recall. It's very bright, vivid recall. Now, the curious thing, of course, is the accident happened at night time, but it's a flashbulb memory for me, so it's very, very bright. Curiously, though, there's no feelings attached to it and there's no sound. It's just purely a moving picture that's in vivid, bright colour and strange. Some people, and you've met this guy, they get angry at some point in their life. They don't remember why they got angry, but they've been angry ever since. And they're very good at recalling the feeling of anger, but they don't really know what it was that triggered it. They've forgotten. They don't even think to recall what it was that made them angry. Now, this is the story that I use. I was in a nursing home when I was much younger, working as a nurse in the care environments. This was elderly care. And there were two elderly patients there who both had dementia to varying degrees. They were previously roommates and seemed to get on very well with each other. And they got into some kind of fight, and they were really going at it with each other. Once we'd separated them, one very, very quickly was amnesic. She couldn't understand why she had these cuts and grazes, and she was fine. She just seemed to be back to her normal self within minutes. The other lady took to her bed and cried, and quite literally she cried herself to death. She died about 3 days later, and she just did not stop crying the whole time. There was at no point during those awful 3 days where she had any idea why she was so upset. She was able to, the kinesthetic aspect of the experience was still very current for her, but without access to the visual or the auditory components, because of the atrophying of the brain, I guess, there was no way she could contextualize what had happened to her. Now, unfortunately, I didn't know now what I know then. So there's different codings of the way, the different aspects of memory, different ways we code memory. I've just got to go back to the question. Limbic system, heavily involved with memory components and feelings and a whole load of other stuff. Here's the bit I'm very keen to caution people against. If you look in pop psychology, pop neurology these days, at the moment everything is about mirror neurons. Mirror neurons are the explanation for pretty much everything people want to make it fit. Back in the 80s, it was the amygdala. The amygdala was the reason why everything happened, and every psychiatric, neurological, emotional difficulty was blamed on the amygdala, or was held accountable. I'm very keen to avoid this kind of stuff because the brain is far more complex than that. There's far more going on than that. But people like these easy explanations. So I refer to some of the aspects of the limbic system's function in the IEMT training. But the main reason for this is just to introduce to people the concepts, or some of the concepts of the different things that are happening in the brain. I'm still not 100% sure that that is the explanation of why IEMT is creating the effect that it creates. Right, next question. Have you ever worked with Tourette Syndrome and IEMT? Answer to that is, no, I haven't. What are the results? Don't know, never worked with it. And if not, would you think that IEMT would have a positive effect, since that Tourette Syndrome is neurological? Now, I simply can't answer that. I would be guessing, and it would be only a guess. If anyone has worked with a Tourette's patient who's got, with IEMT, let me know. Let me know what happens. I'll be interested to hear. Right, what is the difference in the patterns between the normal eye movements, that's this, and the figure of 8, or the lazy 8 as people call it, when you're doing IEMT? Why do we do this, and what does it do to the brain? Now, on the first day of the training, all the eye movements are straight lines, and we're moving in very specific kind of ways. On the second day, when we're looking at the identity aspects, we do very much the figure of 8 movements, and it's on its side. It's not this kind of 8. Now, The reason that we do this might be entirely bogus. It came from an observation that I had in the early experimental workshops and the early trainings. Now, right at the beginning, it was very familiar to have abreactions occurring during the workshops. And we're having lots of people coming along with different backgrounds and different experiences. And typically on the first and second day, on both days in fact, we were just getting lots of abreactions. Then I started introducing variables into the workshop and putting differences into what we were doing to measure the difference in terms of what the effect it had. One of the things I did was, on the first day, I only did straight lines. That's when we're working with the kinesthetic component. And on the second day, for the identity modules, we started doing figure of eights. The results were quite dramatic. Now, there were other variables, so it may not just be this, but the abreactions that we were seeing on a very frequent basis almost dropped to zero. And in fact, in the last 2 or 3 years that I've been running the IEMT courses, I've personally not seen any abreactions occur on the workshop. Now, by abreactions, I'm not talking about people getting upset and that kind of stuff. I'm talking about one person virtually they collapsed and had a virtual fit on the floor. We used to have people running out of the room in tears. We used to have people completely breaking down and weeping. That doesn't seem to happen anymore. Now, it's worth mentioning that those abreactions, or those attendees in the workshop, reported back hugely beneficial experiences afterwards, which is not really what I would have expected at the time. So essentially what I did was then put together all of these variables to create a different kind of training. The idea was to create the benefits that the abreaction seemed to be giving those people, even though at the time it was a little bit concerning, but without the abreaction. So we get all the benefits, but without all the pain. That was the main intention. So the difference between the straight lines and the figure of eight, it might be an artifact. It might well be something that with time that we demonstrate, it doesn't make any difference. But at this time, until we have more information, it seems that the straight lines for kinesthetic stuff and the figure of eights for the identity stuff. Right, next question. How would you deal with clients who claim, gotta like that one, who claim that their negative emotions returned and which were gone during the session? There's several things that could be happening here. One is they're crazy and they're going to complain that they feel bad, whatever. I don't think that's likely. I think more realistically, it's the over-expectation of the efficiency of the technique. I'm at pains to say to people that IEMT is not the grand unified theory of therapy. It doesn't cure everything in all people at all times. It is a very useful technique that is very effective for some things some of the time. And that there's a lot of problems that will need to have other approaches or other interventions. This is just one of many techniques that could be used for people. Now, there's the other thing that happens though. Some people come from really horrible backgrounds. They are living in environments or working in environments that are either depressogenic or they are with people who are irritants. There are things in the environment that provoke them and condition them to feel bad. Some people don't like their jobs, some people don't like their families, some people don't like their marriages. There's all sorts of things that can account for people feeling bad. Now, just because a person feels better during a therapy session doesn't mean their life is going to be incredible from there on in. It's a mistake to expect that because at the end of a session a person feels better, then everything in their life will be fine. There may well be more work that's needed. The technique may not be lasting for those people. We've got to be realistic. For most people it is, but there also may be systemic interventions that are required in order to create a much bigger level change for that person. Or they might not want to. The client's expectation might be, I don't want to change my family, my life, my job or anything else. I just want to feel better. In which case you might need to consider some other approaches as well. Who knows? It's such an individual thing, I can't really be prescriptive for it. Right, next question. The 3 pillars of depression. What is the origin of this theory? I wouldn't say it's so much a theory, it was more an observation. Back in about 2009, a GP sent me a whole load of his anxious clients. He was somebody I knew locally and I'd done some work with, and he sent me what he called the heart sink clients. So I had quite a lot of people that had been presenting a lot of hours in the GP's time, that nothing that they had been able to offer had been of any use to them. So these were people who were still anxious. Now, I was working with them using all sorts of different techniques and interventions. My observation of my work was that they were benefiting in terms of they felt they were getting help. They felt that they had an educational process, so they got insight and they had a better understanding of their suffering, but they weren't actually any less anxious by the end of my work. Now, for me, that was quite a depressing time. Now, I started getting these clients back in and doing further investigations with them and interviewing and analysing the interviews and that kind of stuff. Here was my observation. Anxious people are either forever apologising and have a tendency towards guilt, or they can be very quick to be annoyed and angry. And quite often after they have this blow up with their anger, they're back to apologising again, and then that leads them to being anxious. So the 3 pillars model was a simple observation. The other thing that I saw was that people often would arrive in a state of guilt. They'd be apologetic for taking up my time. They'd be apologetic for being early, apologetic for being late. They'd just be apologetic. Within 20 minutes, they were typically then feeling anxious. Now, some people arrived to the sessions in a state of anxiety. And within 20 minutes, they could be typically expressing anger about something, whether it's about the world, about politics, about me, about the interventions that we were doing. Some clients, they would arrive in a state of anger. Maybe there was something happened that morning, or somebody asked them not to park there, those kind of triggers, and they would arrive a little bit angry and worked up. And then typically within 20 minutes, they were apologetic and feeling guilty, and so on. So I started to ask the anxious clients, tell me about guilt, or tell me about anger. And they would always go, oh, yes, oh. And they would then tell me how much of that is an ongoing experience for them. So rather than focus on the anxiety, I started working the IEMT stuff with the guilt type patterns and regret and remorse and shame, and anger and temper. And what I was finding was when we got either side of the anxiety with the other emotions, the levels of anxiety the person experienced dramatically reduced. So the relationship between guilt and anxiety and temper is huge. And so a lot of those clients were getting dramatic results that previously all the counselling, the medication, and the work that I was doing as well just basically wasn't making any difference to. That's where it originated. I then started testing it out with different people, and it just seemed to stand up to scrutiny. Again, it's not true for everybody. There are people that will come in and they go, no, that's not me. But I would say of the seriously anxious people, probably about 9 out of 10 people, this seems to fit. The 3 pillars pattern fits them perfectly. Right, next question. I have worked with a lot of clients, and often I get the response, they are not aware what happened. The negative emotions disappear, however, they are still impacted. What can you advise the coach? For example, the fear of flying. The fear is a lot less, however, it's still not completely gone. Right, this comes back to, this isn't going to work for everything. IEMT is a very useful technique for many things much of the time. There's going to be plenty of things that it's not going to work for. However, since fear of flying here is specified, let's just talk about that for a second. A fear of flying is often a very complex fear. It's not just a simple phobia. Because if you think about it, catching a plane somewhere to go somewhere is an incredibly complex activity. You've got to pack. You've got to take all your stuff. You've got to remember the passport. You've got to get to the right airport. You've got to get there on time. You've then got to navigate your way through security and check-in and all of the other stuff, where everyone you meet has an agenda to look for a reason to not let you on the plane. They're going from the terminal. They might have a final call, a final departure. Then they have to get on the plane and navigate their way through all the people, and there's a complex set of rules. They have to sit on the plane in the right seat. They have to follow the instructions, and then there's all the fear of what can happen then, and so on. So it could be there are a multitude of stressors and stresses associated with the flying that actually aren't being dealt with. That just taking fear of flying isn't detailed enough for that person. The other thing that with fear of flying that gets missed, why? Why do you want to fly anywhere? Why, if you've had this problem for so long, are you now coming for treatment? There's going to be a reason why they need to go somewhere, and often that might be the stress itself. So there's lots of other things to investigate. Generally, my experience of IEMT practitioners is their expectation set of how quickly IEMT will work and what they can achieve with it is overestimated. They are tending to want to get very, very fast results very, very quickly, and they're not paying enough attention, they're not taking the time, and they're not doing detailed enough work. It's not thorough enough. So it might well be you need to do more work with that person. It's a quick technique, it's an effective technique, but those coaches may need to take a little bit more time and be much more thorough in their work with their clients. Right, next question. Your latest work, Metaphors of Movement. How can we use IEMT and Metaphors of Movement together in a coaching cycle? Not quite sure what a coaching cycle means, but I think I get the idea. Now, just so you know, the Metaphors of Movement work was actually a development that came out of the IEMT work. As I was going further with the IEMT material and doing the advanced workshops, there were some things that started to become quite obvious to me that were much more metaphorical. So this developed out of the identity work primarily with IEMT. Because it became so much more metaphorical and much less eye movement-y, I split the two and then developed the metaphors as a separate entity. Now here is the way that I use this. When a person is messed up by life, as in life happens to the person, shit happens to them, my primary way of working would be IEMT. That's what I would suggest people do. When it is a proactive pattern, so when the person is the one who's the cause of the problems in their life, then I would suggest that for most people, Metaphors of Movement would be a fantastic way of working. So IEMT I tend to use for more the remedial stuff, and especially around the harm that could happen in identity, because growing up, it can be terrible what can happen to people in terms of identity problems. And for more sort of adult, grown-up behavioural stuff that we do, the metaphors would be a good way of working. Generally, I would suggest to people, if you're going to mix the two, I wouldn't necessarily be doing them in the same session. I would probably divide the sessions. Do the IEMT remedial work first, even if that's only brief, send the person away. Wait a while for them to make those changes in their life, bring them back and do the generative, the other work, Metaphors of Movement, which will be much more generative. Next question. The neural pathways, nerve cells that transmit messages in our brain have been trained to behave in a way that we are familiar with. This behavior can be positive and negative. Some people say that to alter a behavior takes at least 21 days to get accustomed with. In IEMT training, we learn how we learned to feel about ourselves in certain situations. When negative emotions of the past have been eliminated, what is your philosophy with regards to the impacts to behavior in the future? Right, there's all sorts of stuff around the ecology of change, about well-formed outcomes, about future pacing, future projections. How long does it take before the change generalizes into the person's life, and all those other things. My position on this is very, very simple. I personally believe that the vast majority of therapists massively overestimate the impact and the effect of their techniques on their clients. Just because I do a future planning with a client, or a well-formed outcome arrangement with them, or I do some future pacing, doesn't mean anything will happen in the future for that person. There's no relationship necessarily between what I'm doing and then what the person does once they leave the session. That's an important thing to remember. Basically, what I'm doing is giving a person the maximum opportunity by which they can make decisions about how they live their life for themselves. I'm not in charge of how they live. I'm not going to control their life unless I follow them around everywhere with a big shitty stick and keep reminding them to make that change so it generalizes across. So my position here is I don't get involved in that kind of stuff. Now, that's not because I don't think people should, but because my work is around more intervention and change than care and support. It might well be that for some people the relationship they require is a much more caring and supportive role over a longer period of time rather than 1 or 2 or 3 interventional type sessions to create the change for the person. So it's a difficult one to answer. I think a lot of people haven't actually considered what their role is. I know there's counsellors who are sort of in between the two, between change and support and, change and intervention and care and support. Their work can often bridge between the two areas. There's a lot of people who are just doing NLP, for example, which is primarily about intervention. And they might be inadvertently trying to do the caring, sharing thing simultaneously over time. And there's people who are very supportive and caring over long-term stuff who are trying to do too much intervention when it's not appropriate to do so. So it's important to know what you are, and if you're between the two, when and how you would recognize the difference and when to apply those things. Right, next question. When a client is a depressive and has medication which suppresses or has effects on the regulation of emotions, how effective is IEMT and what would your advice be for the coach? Right, again, I can't advise you on this one. However, I can tell you my position. I don't get involved in any capacity with people's medication. I don't prescribe it, therefore I don't recommend people change it. Now, I will periodically liaise with a prescribing doctor, a psychiatrist or their physician. If the person's under forced treatment, for example, they are under the Mental Health Act and have a compulsory treatment order against them, or there's a risk that if they change their level of compliance with prescription, then they could end up on a forced regime. So then I will liaise with those people just to let them know what I'm doing. But when it comes to this person's brain is going to be incapacitated for change because they have medication, I simply don't even get involved in it. It's not my issue. It's not my problem. There's nothing I can do about it. It's between them and their doctor. But as I say, occasionally I might just need to talk to the doctor first. So my advice for a coach: your patient's on Prozac, so what? If they're on a neuroleptic medication, so what? What's your interest there? My concern would be, as an IEMT practitioner, do you have an agenda which says you believe these things are wrong and that there's much better ways of working? If that's the case, you need to readjust some of the values and the ethics that you have. It's important to know that sometimes medication is the best thing for people. The powers of the IEMT practitioner, or whatever capacity they are operating in, is limited. And there's a lot of factors out there in the world that are more influential than any therapist. So sometimes the medication is important. So it's worth having an awareness of medication. I don't get involved with it at all. Right, next question. How did you develop the IEMT technique? Was EMDR the basis? Yes and no. I was aware of EMDR, and I was aware that eye movements were being used in certain ways. I didn't do any EMDR training, but I did start experimenting with eye movements. IEMT came about from a number of observations, one of which was eye movement work didn't seem to have any effect on anticipated problems, which suggested to me it was much more memory-based rather than anticipatory. However, if I anticipate something tomorrow or remember something from yesterday, other than location, how are they actually any different? And that was what the beginning was. I started to ask, okay, why doesn't this work? And then with repeated development and experience with things, I noticed patterns in client behavior that the eye movements were very effective at tackling. And these became the patterns of chronicity, which, as far as I'm aware, form no feature in EMDR work. So there's an overlap between, there's eye movements and stuff, but I would say apart from the awareness that eye movements produce change, EMDR didn't have any other influence in what I'm doing. They are completely different models. Or they're exactly the same. In the same way that Freudian psychoanalysis is exactly the same as Richard Bandler's NLP, because they use words, right? They're exactly the same. How would you explain in simple terms to a person who has no knowledge of this work what IEMT is? Think about the problem, move your eyes. Try it, and then we can build on that. There's more we can do. Because sometimes when you move your eyes, it changes the way you look at things. And when you change the way you look at things, you can start to change your perspective. When you change your perspective, you can start to change the way that you feel. When you change the way you feel, you can start to change the way you think and who you are. And the next thing you know, you're a whole different person. I can't say that again. Can we expect an upgrade or addition to the IEMT protocol? Yes, you can. I'm constantly tweaking it based on the feedback that I get, both from practitioners and the other trainers, but also in my own client work and client feedback. There are little tweaks that keep happening. Do you use IEMT in the Slimming in the Attic program? Would it be beneficial addition for IEMT practitioners? Can you tell us about it? Yes, I can. I'm going to do that in a separate video though. So I'm going to edit this one now. I will produce another video about weight loss and using eye movements and IEMT stuff. So thanks for watching this, and there'll be part 2 shortly.